I've got sort of one goal for you all today, and that is to try to convince you of the importance of getting a colonoscopy to screen for colorectal cancer. I'm not a politician. Even if I was a good politician, there's really no way to spin colonoscopy as an easy, no problem, enjoyable, great way to spend your Wednesday afternoon kind of a thing. What is colon cancer? A key issue is that colon cancer develops from polyps. Polyps are mushroom or wart-shaped growths that develop on the inner lining of your colon. When a polyp first forms, it is benign. If that particular polyp goes through a series of mutations, that polyp can turn into cancer. So there's what we call this polyp cancer sequence that is uniformly the case in the sequence of colon cancers. The American healthcare system has a problem. You don't go to the doctor if you feel great. You go to the doctor because there's some problem. Oftentimes, disease states are beyond a simple cure or a simple treatment when you wait for symptoms. And that's particularly true in the GI tract.
My name is Debbie Whitmore. I'm an RN, not working now as an RN because of my diagnosis. The social worker said, stay home with your family, make memories. My kids are the youngest just turned 8, up to 17. 15 months ago, on November 16th, at age 44 is when my whole life changed. I was diagnosed with stage 4 colon cancer, terminal diagnosis, no cure.
2 years ago, I was having a routine checkup. I went to my doctor and I said, we're getting near the end of the checkup actually, and I said, well, I've been having this problem when I go to the bathroom, and it's been really awful, and I have this pain. And he poked on my abdomen and I doubled over, and he said, oh, that's not good. And he said, oh, I'd like you to get a CAT scan, a CT scan, sometime by the end of the week. This was a Wednesday. And I said, well, I can't. I got to go out of town tomorrow. I'm not going to be here. As always, you know, I'm way too busy for this screening stuff. But he scheduled a CT scan for me at the local hospital 2 hours later.
The doctor said to me I was a little bit anemic, and he said, you know what, which was so great for my primary care physician, he said, well, you should have an endoscopy and a colonoscopy, start some iron and be checked out. But I ignored him because I'm a nurse and I know better. I just thought, oh, it's nothing that bad, and thought I don't need to have this done. And of course, you know, thought who wants to have a colonoscopy? Also being fearful of the prep, which isn't anything. So did my exercise, lost 20 pounds with my friend, but was short of breath all the time. You know, I just couldn't keep up with her. I kept thinking, boy, I'm really out of breath, and my heart rate would go up. So then I knew again, I'm like, okay, this isn't normal. I shouldn't be short of breath and feel a little dizzy. So I went back to my primary care physician, who said, did you have your colonoscopy? Did you start iron? I said, no. So he was mad, and he said, you need to do this, and checked my blood count, and my blood count was again even much lower, where almost needing a blood transfusion. So then I realized, I said, oh my goodness, and there's no blood I ever saw anywhere, you know, in my stool or anything. So then I finally called to have the colonoscopy, and it is no big deal, especially for what we are both going through now. I mean, the prep is a cakewalk. Please just use our stories, and don't be afraid of having to take, you know, some type of a prep.
1 in every 3 adults has polyps. So this is why screening can be cost effective. The fact is that it's the second leading cause of cancer death in the United States. About every 10 minutes somebody dies from colon cancer. Here is the colonoscopy. This is the inner part of your colon here. And here's this polyp. So these are mushroom or wart-shaped growths. This is not an early polyp. This is an advanced polyp. We can examine the surface of this polyp pretty carefully. We can get a pretty good idea of whether or not there is cancer in it. And this one looks benign, but this is well on its way to becoming a cancer.
I didn't have a colonoscopy at age 50. Instead, I was diagnosed at age 55 with metastatic colorectal cancer.
The second oncologist, the head one, came in and he said, They were very clear. They said, you know, there's no cure. This is palliative treatment. Same word you said, you know, meant to help the symptoms, prolong my life, but, you know, terminal cancer. With the BRAF mutation I have, the average person lives about 12 months with treatment. They said if I hadn't had any treatment, I wouldn't be alive today. But I've passed that mutation. The tumors aren't responding like a typical BRAF. But then I said, oh, you know, somebody with the liver mets, and they said usually 23 months is the average, and I'm 16 months now. But it is just an average, but you just, you know, to ask that question, just, it's surreal, you know, when you think it's about your own life.
The age that you get your colonoscopy depends upon your own situation. For average risk patients, it's get your colonoscopy at age 50 or near the age of 50. And then if we don't find anything, if there's 0 polyps seen, the recommendation is to get another colonoscopy in 10 years. If we find polyps, then the surveillance interval goes down depending on what polyps we found and how many we found. The best way that you can reduce your risk for colon cancer is to get colonoscopy. It is the most effective screening tool, and it has reduced the risk of colon cancer by 90%.
We're already preparing our children for what's ahead. We've made a video from a company that comes called Life Chronicles. Talk to each child individually, knowing that this is what they're going to have of me. So, you know, maybe in 2 years, if I'm not here, they can hear me. I had to read a book with my little boy, who was 7 at the time. My other children, you know, they ask, you know, what do you remember about your mom? I had to tell them things I am proud of from them, because you have to think this is all they're going to have of me. And I had told my husband that it was okay to remarry, because he'll be under 50 by the time I die, most likely. Love your children, love your spouse. You just never know when your life can change.